we've had different people where we talked about addiction on the podcast, and like I've never been addicted to opioids or drugs necessarily, but for from 11 to 24 for 13 years, I was addicted to pornography, and it was something that like I'm 30 now, so I've been 6 years removed, but I remember at the time, like all the times that I would use it was because I need pleasure. I need dopamine. It was this strong drive for dopamine. Now, I also started jujitsu around that age and I didn't realize it. Like for a long time, I think for 6 years of that time, since I was 18 or 19, I was trying to quit. And me and my friend, a close friend of mine, Brian, we would have tactics. We would share each other's phone passwords where we'd try to do these things to mitigate our use. And it was beneficial. But for me, the time that I started jujitsu, this practice that just drove me into this physical side of things, slowly it became much easier not to have that drive. So I replaced the drive with pornography with a physical outlet of jujitsu. And that's something that I do super consistently. And I don't feel any drive back, but it was something that I didn't intend it to replace, but it did replace the habit. So now it makes me curious for people that come into your clinic that they have these different, literally heroin, different types of addictions, which we can get into what you guys deal with. Huh?
Fentanyl, 1,000 times more powerful. Right?
How do you guys handle the replacement approach? And is it unnecessary? Because if Iboga works on that glial-derived neurotropic factor thing, that is the pattern, I guess, recognition, right? How do you guys help people replace old patterns with something positive, if that's something you deal with?
Absolutely have to. Of course we do, and it won't work. Otherwise, it's a drive-through detox, right? And again, if you want to talk about, more cynical aspects of what might happen with, conventionally commercialized type use of a substance, it would be a drive-through kind of, not literally, but a frequently recurring detox, rehab safely. We'll clean you up, get you back out there, come on back when you're ready. Mm-hmm. I don't believe in that. I think that it does a great disservice to people, and we have examples of that. We have examples of that in the pharmaceutical industry. So I love your story about what I would call a maladaptive coping. You're treating something with pornography. Mm-hmm. Whether you know it or you don't, you're treating something, and you need to get high. So needing to get high shouldn't be something that causes harm, right? Everybody needs to get high. Everybody needs to feel many of the aspects of the experience that are often associated with illicit drug use or compulsive behaviors. There's many of them that are really great. Like, you should be allowed to have certain secrets. You should be able to have certain adventures. You should be able to have time to yourself when you feel like nothing is wrong and life is great and you're all good, But if having those types of, or maybe even do that with somebody else. Yeah. I'm all on my own, but I'm with you too. Like, whatever. If you have to take the risk of harming yourself or someone else, or actually harming yourself or someone else to do that, I would say you're using the wrong medication at the wrong dose at the wrong frequency. Nothing wrong with the need, though. Mm-hmm. The need is awesome. So you replace that with something that is known to be far less harmful and satisfying a need, and it worked. Now, you still are aware that this maladaptive behavior is out there. You just, for some reason, it doesn't appeal to you anymore. Yeah. Partly because you don't have the acute need, and partly because you've probably matured and you see it differently as well. You see yourself differently, most importantly. So I think that having this replacement is a fundamental requirement, and GDNF causes people to be open and willing and even excited about participating. Mm. So now it's not like, think about this idea. You take away my drug, my most pleasurable experience. And fine, if I don't take it, one might have severe withdrawals. I get sick, I shit my pants, I'm sweating, I'm a nasty, awful person. No one wants to be around me. I don't want to be around anyone else. Okay, let's say we could take that piece of the puzzle off the table, but we still didn't replace it. What's the fucking reward? Like, thanks a lot. So now the one thing that worked for me that made me feel great and eventually I needed to feel normal, you took away, but I don't have anything better. Like, where's it could be any type of jujitsu, metaphorically or analogously. So we have to intervene and quickly focus on all the issue areas: family, self-esteem, money, career, self-image, sex, all the parts of our lives that first we see as kind of adversely impacted of this behavior. But the clue is those are the things that are important, right? Those are the relationships, the sense of self-love and self-esteem, worthiness, a need of people that might use something like pornography might be to feel a human connection. They're just using the wrong way to do it. So if you take away the pornography, they still have the profound need for human connection. We need to help them figure out how to get into a way of being first, change their thought system, right? What are your thoughts about human connection, your worthiness, your ability, the experience of it? And then the other is your belief system. If you think that you're going to fail and you're unworthy of connecting with people, going out and meeting a friend or picking up someone or, having exciting, adventurous, satisfactory human connection is going to be extremely stressful and difficult.
Hair Project family, how's it going? Now, Piedmontese Beef is a company we've been eating literally for years now because they have some of the best beef on the market, tons of cuts, tons of different types of beef. Check them out. Andrew, where can they get it?
At Piedmontese.com. That's Piedmontese.com. And at checkout, enter promo code POWER to save 25% off your entire order. And if your order is $150 or more, you get free 2-day shipping. Links to them down in the description as well as the podcast show notes.
So we don't give dating coaching services. What we try to change is your relationship to the core of your sense of being. But that can't even begin without intervening, getting people off the substances and introducing this miracle grow for the brain and using the environment. So one-on-one therapy, group therapy, a lot of writing, a lot of art, a lot of music, a lot of sound, a lot of fitness, high intensity interval training. All this stuff is causing people to do more than just sit in a room and go, well, wow, I feel like I'm not on heroin anymore. I'm not on meth. I'm not taking these drugs, but I miss them. You can't miss them. You can mourn them. This is fascinating. You can mourn them, but you can't miss them because it's sort of like that part of your identity has to die. And if it's dead, but still living on the block in the bad neighborhood or wherever, or on the internet, on the dark web, you're eventually going to go see that side of yourself. So we need it to actually be dead, and we can mourn it. We can say goodbye forever. We don't have to forget it. Just like we don't forget somebody when they die. We want to learn from it. We want to grow. I said that all healing is growth. So we want to put it to work.
Hey guys, if you like this clip, go ahead and comment down below and let us know what you liked about it. All right. Share this with a friend. Make sure to subscribe to the channel. And also, we are on Reddit and Discord. All that's down below. All our sponsors and everyone that supports us down below there too. So you can get whatever you like from us. All right. Peace.